Well, it's great to be back in front of some of you. I'm really excited to be here and was really happy that they asked me to do this. It's a little bit different than what I normally speak about. And the reason is that this is, it's somewhat more personal than the kind of addresses I usually give. I mean, I'm not going to go into my life story or anything, but I'm going to give a lot of insight into the way that I think about leadership and the way that I think about design. My company is, we do design, but we're not an architecture firm, which is very confusing to a lot of people. We design facilities and we plan facilities and we design processes, and we essentially work for change within the system. And we also work for change outside of the system, but a lot of what we do in our daily work is within the system. And when I was thinking about design thinking, I thought about talking to you about the kinds of things that we do there. And then I decided that that wasn't really what I needed to do today. So when I saw the plan for the day, and I saw that the topic was the promise of population health, a lot of people focused on the population health part of that, and I really gave a lot of thought to the promise part of that. And a lot of what I do and how I spend my time is actually focused on that part of the equation. I feel incredibly committed to the safety net populations with whom I work. We work with healthcare across the spectrum, but my thing, my real thing, and my real passion and area of expertise is in the safety net healthcare system, and I do a lot of large urban hospitals. And what I want to share with you today is what those of you who are not working at CMS and who are not CEOs of large systems and are not deans or other prominent positions where you have influence by your title and by the experience, obviously, that gave you that title. But I want to share with you a way to be effective wherever you are. And I'll start just by sharing that I literally eat, sleep, and breathe healthcare. And those of you who spend any time with me really know that. And I was driving some 13-year-old boys to a hockey tournament a couple weeks ago. And they were talking about how they're going to be NHL players. And just for the record, these are not AAA kids. I didn't tell them that. I mean, they certainly get that, but they still think, you know, from their level, they can be NHL players. So I'm listening to that, and then the conversation kind of turned to, well, maybe I'll play in college and then get a job. And I'm like, oh, yeah, you're probably not playing in college either. But so I'm listening, and I'm driving, and one of them said, well, you know, what is it that you do? I know that you get on planes all the time, but what do you actually do? And I got real serious for a moment, and I looked at these boys, and I said, I relentlessly pursue change in the healthcare system every single day. And I said, and if you would like to do that, come join me. It's different than the NHL. So I tell you that story simply because I think that the way that we talk about what we do is incredibly important. And if when somebody asks you, what do, you tell them what your title is, or you tell them, I work in healthcare, that's not really very helpful because they're going to think that you're a doctor if you're a man, and they're going to think you're a nurse if you're a woman, because we're still there in 2017. So I think you need to be a lot more specific to get what you want. And I spend a lot of time really reflecting on what I see and what I do, the conversations I have. I will probably mull over these conversations from the morning talks a lot and kind of pick them apart in my mind and try to decide what to do with them. And I think that that is time well spent. And those of you who had me in the classroom, I spent a lot of time talking to you about being mindful in your everyday conversations, and that change is made in those one-on-one interactions that you have in your Uber ride, or that you have on an airplane, or that you have at the dinner table. And you can make change on a big stage, but you can really make change on a small stage if you know who you are and you have that sense of self. So I bring that into design thinking because, and this actually, Rick set me up really well for this talk. We've never met, but he set it up really well because he spent a lot of time talking about empathy and about how you build things and how you innovate. And design thinking really, it can be an event. So many of you have probably done some design thinking. I know if you're a student at U of M, you probably have. You've probably been trained in the methodology. You may have worked with a consulting firm who did it for your hospital. And a lot of people pay for it. They pay for it as a service. And you can do that, especially if you want to get trained or if you want to involve 300 people in your organization in doing it. But I use it as a tool for myself as well. I mean, for me, it's a mindset, it's a way of thinking. And I work in frameworks. So anytime that I'm trying to think through a problem or trying to understand a situation, I choose a framework. And there are many of those. You probably are trained in a lean framework. A lot of people know how to think about lean or Six Sigma or some other kind of framework like that. But if you use what the mindfulness or the design thinking components are in a mindful way, it really can create a leadership mindset for you that can change the way that you look at problems and change the way that you interact with others who are either having the problem or are trying to solve the problem. So the first place to start with design thinking, and this is not going to teach you exactly how to do it. So if you want to do that, there are lots of resources, endless amounts. David Kelly is one of the founders, so founder of IDEATE, the Stanford D School. Those are great places to learn about design thinking, or if you want to hire someone, they're great people to come in and do it on a large scale. But you want to start with the wicked problem, and there is no shortage of wicked problems in healthcare. And a wicked problem, by their definition, is one that we've just decided to accept because we're just used to it. I would say waiting would be a good example. You know, it's not wicked on that like someone's going to die because they're waiting, well, though people do. But we just accept it, and we accept traffic. We accept other major things. I put this on the slide because, one, product design is where design thinking comes from. We've taken it from them. Designers are trained to think this way. They don't even call it design thinking, they probably just call it thinking. So they're trained to think this way, and it's in disciplined steps, and it starts with a problem. Now, this is an example of really how the iPod was born. So those of you who are closer to my age or older might remember the Walkman. That was one of the like fancy versions. You had to babysit a lot to get that. And we thought that was amazing because we could take a bunch of CDs with us and that would fit in your backpack and you could actually run with that. Believe it or not, we ran with that. And it had like an arm sleeve. It was like carrying a desktop computer on your arm. So, but where design thinking and wicked problems like mesh is when we can jump the curve is what it's called. So they could have just designed a bigger bag, right? You could carry your entire music collection if you had a big enough bag. And if we put wheels on that bag, then just think of what you could carry. That we could have eventually gotten there and you could carry your whole music collection. But they jumped the curve when they said, we're going to completely change the way that we store music and then change the way that you carry it around. And then when they added a phone to that, I mean, get out. Like that was everything. But in healthcare, we're in such a different situation because we have wicked social problems and we have wicked health problems, and they're not easy and there's so much more at stake. So this framework can offer some hope. So I actually heard maybe pessimism and optimism in equal parts this morning, but I heard a lot in the breaks just frustration that we're still talking about some of this. And frustration that some communities have been talking about social determinants of health for 20 years, and others are just now discovering it. And there's frustration in that disconnect for a lot of people. And we need to get on the same page with communication. But we also need to agree that certain wicked problems are worth our investment and worth solving, which is some of what I heard this morning. So I'm going to talk through the framework of how you can use this from wherever you are. I mean, you can use it in your personal life too. It actually works equally well. But within an organization, when I said Rick set me up well, when Rick said if you're in an interview, focus on outcomes, this is a really great framework to do that. So let's say that you don't have a lot of outcomes. You still could take a problem through this framework and create your own outcomes in preparation for that job interview. And I'm not joking when I say that. Like, you can create change and do experimentation and have an outcome and have a story to tell if you follow this, and you can do it on your own. Design thinking it's a group collaborative process, but the steps work really well even if you're doing them on your own. So the first step is empathize. And IDEO spent a lot of time on talking about empathy and empathizing and following people around and shadowing and all those things. Okay, so they were founded in 1991. But I actually think that Donna Bedian deserves credit for this. Because in 1966, and I know that anyone who had Rich Lichtenstein knows Donna Bedian really, really well, like he's our grandpa or something. And in 1966, Evadis Donna Bedian, in his Structured Process Outcomes seminal article, at the very end, go look it up, you can see at the very end, he actually makes a really important statement that isn't talked about as much as the first piece. And what he says is, quantitative things are really important, measurement is really important, metrics are really important, but at the end of the day, you really have to ask, what goes on here? And sometimes, instead of saying, this is what's wrong here, you need to just focus on stepping back and observing and saying, what goes on here? What's happening here? What are the values? What's the culture? What community have I stepped into? And that is a really important component that's huge in design thinking. So the first thing that you need to do is really ask, what goes on here? And my team hears this a lot because we sit in cafeterias, we listen to people, we go into communities. I want to be on the bus that the patients ride into the hospital. I want to see, I want to hear. I mean, I need to feel like I really know that community. And that's where that promise comes in. You can't really feel like you have made a promise to a community that you don't actually know. I mean, that's really, really hard. It's not then a bond and a connection that you have to deliver on. So to me, that empathy piece is really, really huge. So the second piece is define. And defining is, again, it's a disciplined step in the process. And the way that we would approach it in a project, or that you could approach it on your own, is when you define, you take the wicked problem that you've now learned more about the people that it impacts most, and you turn it a million different ways. And I think of this step almost like a kaleidoscope. So you can have the same 25 components, and every time you turn it, it's going to look different. So you take and you dig deeper, and you try to define what's really going on. So you're answering what goes on here, but you're answering it within the context of the wicked problem that you're trying to solve. And the key to this, if you want to try any of this, is just to end up with a list of statements that start with, how can we? You could do how can I if you're doing it by yourself, but it really is sort of a group project. So you want to say, how can we? And you want to phrase everything that way. And the reason that you want to do that is because it leaves open a world of possibility. Instead of saying, how can I reduce wait times for screening colonoscopies, you change that to, how can we improve access for the people who need it most so that we can improve our screening colonoscopy rates? See how that's just like slightly different? But you want to frame the question so that you can generate a million ideas, and there's a reason that you want to do that. So when you're ideating, which is kind of a funny made-up word, all it means is you're generating a huge list of ideas. And this is an incredibly important step. And unfortunately, it's often the last step for people because they don't finish. Okay, and we're going to talk about finishing in a second. But the ideate part is the part that everyone can participate in. And in fact, the more people you have, the better, because they're going to have different ideas than you. And if you choose people that aren't like you, that's even better. Although everyone in this room is wonderful and we're one big family, so I'd want to do it with you. But we should also bring in some outsiders who can look at the problem differently and have a different experience. And you have to write all those down. You can't just think it in your head and say, okay, I did that step. You have to write them down. And there's a reason for that. And it's best if you write them down on Post-it notes or on some computer system that allows you to move it all around later. Because once you have your ideas, and I'm not talking about 5, I'm talking about 50, okay, like a lot of ideas, then you want to group them. And you're going to put them in categories, and you're going to look for synergies. And then eventually, when you keep grouping in different ways and look for themes and try to gauge like, well, I really think this could work, or this is really unrealistic, but wow, if it worked, it'd be amazing. You want to do something so that you can judge the value of your ideas. So once you group them, there will be 2, 3, 4 that rise to the top as really being something that are worth looking into. When you start looking into them, this is the fun part. This is the part that people always show a lot of pictures, and people love doing it, and it's what makes the front of the website because everyone's really active and excited. And that's by design. You want to get people out of their seats. You want people moving around. You want a lot of talking. It should be a loud room. You want people to be able to be active. But the important thing here is that it's a serious process. You want to try to build something. And you're truly building a prototype to say, I think I can fix this problem. And I think I can fix it this way. And I recently did this with somebody. I have a safety net client who was sharing an ambulatory strategic plan. And I was just in the audience. And they shared their strategic plan. And they skipped over this one slide because they were talking about their patient access committee, which, by the way, once you have a standing agenda item, you are no longer actively fixing that problem. So don't have a standing agenda item, like make something happen. So, access problems is the standing agenda item for them. And I said, go back to that slide for a second. I just wanted to see the numbers that you skimmed over. And they skimmed over it because everyone else in the room knew the numbers, right? And it's just accepted. Well, it said that there were 5, if you were referred by a primary care physician today for a screening colonoscopy, you were going to be number 5,549 on the list. Okay, so anyone who thinks that we have given all this new group of people access to the healthcare system, we've given them access to an entry point, and that's it. And the wicked problem is on the other side of that, which is if we truly want to deliver on population health, we have to find a way to get people to services that are not lucrative enough for a lot of people to want to provide them. And so I went home and spent a lot of time on this. It's totally out of my lane, which oftentimes this process gets you out of your lane a little bit. But I went back, and the CEO is a friend of mine, and I slipped him a piece of paper, and I said, totally out of my lane, here's 6 things you can try. I've worked them up, I prototyped some of them, I want you to have it, hope you do something with it. And he called me the next day, and he said, 4 of those we had never thought of. And I said, well, you're not thinking of them because you don't even notice it anymore. Like, it's just such a problem that you just don't even notice it because people have given up. So anytime in your organization people say, oh yeah, we tried that, challenge them on that. When did you try it? Because if it wasn't last week, we need to try it again. And oftentimes, that's like that's institutionalized, that we tried that in the past. Once you develop your prototype, you're going to come up with two options. Don't try to filter it down to one. And then you're actually going to start sharing it. And this takes courage. I was super nervous when I gave that to the CEO. Because 1, I thought, maybe these ideas are dumb. 2, I thought, maybe they're impossible. 3, I thought, if they were good ideas, I'm sure someone in that organization already thought of them, which is a common trap we fall into. You just assume that you couldn't have an idea that's better than someone else's. And you have to be brave enough to go out there and say it and start telling people. And people who shoot you down, you just welcome that and say thanks and go on to the next person. Because one of those ideas are actually going to solve the problem. And if we kill them before they get airtime, then we're never going to get anywhere, and we're never going to deliver on the promise. So I leave you with that process because it's the most equal opportunity process that we have, really. Because there's nothing that can stop any of you from doing this. You don't need a degree to do it. You don't need to be trained. You can read up on it yourself. And you can use this framework to approach any problem. And the other thing it's going to do for those of you who are new in your career, if you work through this on your own in advance of a big meeting where you don't really know what's going on, you're going to be really knowledgeable by the time you get through this process. But don't stop at the ideas. You have to prototype. Because it's when you prototype that you're going to figure out why things will or won't work. And I really encourage you to use it and to do it. And at the end of the day, I think it also just takes courage to stand up and say what you believe in. And I've chosen to do that. I'm in a position now in my life that I can do that. And I'm proud of the fact that my kid thinks I'm a politician. I'm not. But he actually said that the other day. He's like, wait, are you not a politician at all? And I'm like, I am not a politician at all. I've become a professional activist. And I have like 4 of those signs, and I really wish I could wear them as a billboard because I feel that strongly in my conviction to fixing healthcare, and I'm going to work at it every single day. And if I need to, and I'm stuck, this mindset really helps me, and I hope it'll help you too.